Welcome back to another episode of ATtalks. We're still working on the athletic training student and the early career athletic training guide. This is a bonus episode, and I'm with Dillon today. We're going to talk about emergency preparedness / equipment / handing that emergency situation to EMS. He's a professional. He knows it all. He's going to talk. I'm just going to sit here and listen. Dillon, could you introduce yourself to the 7 people that watch this?
We'll get you up to 8 after this one. So I'm an athletic trainer and emergency medical technician. I currently work in the North American Hockey League for a team called the Amarillo Bulls in Amarillo, Texas. Prior to that, I worked at Colorado College within their rec sports. And then prior to that, I worked covering special event EMS, specifically sporting event EMS, in addition to concert and other things of that nature. And then my undergrad in athletic training is from Miami University in Oxford, Ohio. That's where the majority of my 911 experience as an EMT comes from, because I worked for the local fire department there while I was a student there. I like to say that athletic training is my career, emergency medicine and athletic training is my passion. So that's what I do in my free time, especially because our athletes' lives depend on it. So we better be good at it.
Yeah, and if you're not following Dillon on Twitter, follow him because he's putting up all this great emergency everything. A to Z, he's putting it all out there. He's even doing 20 minutes of CPR, man, in 10 seconds.
Heck yeah.
I was so impressed with that video. I was like, wow, that's awesome. All right, so let's say, hey, welcome to the team. You're coming to East Chicago. That's where I work, everybody. Here's your keys. You're going to start tomorrow. What are the things you're going to look for when you get to the school in terms of emergency equipment?
Right. Day one, I'm looking for an AED. That's got to be it. And if I don't have an AED, I am sitting in my AD's or whoever's office, and I'm saying I need an AED. Most schools should have an AED already. Now, it doesn't need to necessarily be an athletics dedicated AED. I just need to make sure that there's an AED that I have a key to get to, or that it's easily accessible some way that other people can get to where it needs to be. That's probably even day one. That's me looking around as I'm doing my interview and talking with them. I'm making sure that that athlete safety is their priority. Just, and if they're honest, they'll say, hey, we don't have an AED, but that's something that we can definitely work on. So I always make sure that there's an AED, and I think that some states even require public schools to have AEDs with them. So just making sure that there's something on campus. That's gotta be there. That's essential. The rest of the equipment, I'll get into kind of what I carry, my emergency bag in a little bit, but you want to look at your splints. You want to look at, your stop the bleed supplies, your tourniquets, your gauze, your quick clot, kind of those life-saving things. If it's AED, stop the bleed, splints are kind of my top 3 that I'm making sure are there. Within the first week, AED is definitely first hour that I'm there for sure.
Okay. So they go, yeah, we got an AED. It's outside the gym. What are the things that you go through and check to make sure the AED's functional and ready for emergency use?
Right. So every AED is different. So the AED that I have at work, it's a Cardiac Science Power Heart G3. It's got a little rescue ready indicator type deal, and it's either because I'm colorblind, but I can still tell that it's a green circle because that's what the manufacturer told me. It's either a green circle or a red X, and I don't see an X, so I know it's a green circle. Other AEDs have a flashing light. I'm looking at the manufacturer and saying, what is your status? Others have the word okay with a battery charge indicator on it. It all just depends on, I'm making sure that there's that. Now I'm making sure that I have pads that are attached to the AED. So I actually learned something new when I first got to this job. Checked my AED that first hour. I noticed that I had an error code on my AED. Like, well, this isn't good at all. I actually ended up sending it into Cardiac Science, and they said your pads are wrong. So I'm making sure that my pads are connected, because if I've got some pads my pads weren't expired, but there was a fault within the pads. So Now when I do a daily check, I check for that readiness indicator. I make sure my pads are plugged in and that I still have a good ready indicator, and that I've got enough battery power. And depending on, your setting, I'm going to make sure that I have maybe a towel to wipe off sweat or water if I'm by a pool. I'm going to have a razor to make sure that I have that I can, have a bare chest to place the pads in. And, it's not necessarily essential, but I would like a second set of pads with the AED, just God forbid, in case something were to happen. And then preferably a bag valve mask, or just some form of CPR pocket mask, CPR shield, something along that nature. All should be contained within the AED itself. And that's what I'm making sure is there. That's the first thing I do when I get into work every day is I check my AED, and then I also document that my AED is good to go for the day. Just making sure that everything's good.
And fun fact for anybody watching this, all the AEDs I've ever practiced on had a shock button, typically like a triangle. So you'd be like, shock, it'd be like, shock advice. And you're like, everybody off, shock. Woo. The AED I have now, it'll do it itself. It'll say shock advise, and then it'll do a countdown itself. And I YouTubed that because I was like, there's no shock button. So how do I deliver a shock? And the YouTube manufacturer video said it's going to do it by itself. So, cool. All right. So what other goodies besides it? You mentioned Stop the Bleed.
Yep.
Which I didn't hear of that until about a year ago. And when I brought that to my nurse was like, "Oh, we've had those for years. They're behind the AEDs, little pouch with some stuff in there." So what does a Stop the Bleed consist of? So
Stop the Bleed. There's an official training that you can attend. It's put on by the American Academy of Surgeons, the National Association of EMTs, Department of Defense. They all kind of got together. I believe it was created after the Sandy Hook massacre, after there was a large loss of life due to blood volume loss in that situation. But basically what it is it's life-threatening bleeding and how to manage life-threatening bleeding. Most people think life-threatening bleeding tourniquets. So your Stop the Bleed kits are going to have a tourniquet in them. They might have some form of wound packing gauze. There's specific wound packing gauze, and then there's also, just rolled gauze, things of that nature. You might also have Quick Clot, which is a hemostatic style gauze. Most of the time it's got a shellfish protein that is in it that clots. Now, people who are allergic to shellfish don't need to worry about it. It's okay to use. You don't have to worry about having an allergic reaction to it. That helps clot the bleeding. You might have a chest seal in there, just things that can stop bleeding in a relatively quick matter of fact. Now, I mentioned that it's going to have a tourniquet in there. Something that I always check when I'm checking my Stop the Bleed kits is making sure that I have a real, genuine tourniquet. There's a lot of fake tourniquets out there. And when I get into kind of showing my kit a little bit later, I'll point out how to tell if you have an actual tourniquet that is approved to help in those situations. And most times, like what your nurse had said, most times the Stop the Bleed kit are going to be either in the same wall-mounted cabinet as your AED, or it's going to be right next to your AED. It's normally in a red kind of bleeding control type of case or bag or whatever it might be.
Before we get into the your bag, which no spoilers, you can tell the world what your bag's called later. But I'm interested in how do we make calling EMS, delivering that information and the transfer of care efficient as possible. Because almost every fall season I have to call 911 at least once. So let's go with athletes down in the field. I have an AED, I have a SAM splint, and that's basically my tools. So I make my X, that's everyone knows, 911. So we call 911 or a police officer will radio 911. From that point on, what information are those people looking for?
So the way that I have my emergency action plan written out is there's a section in there that talks about emergency communication, which you mentioned. It's either a radio, a phone call, your hand signal to the signal, hey, let's get EMS here. That should all be documented in your emergency action plan as you build it. but I also have in a completely different colored font, bolded, this is what you say when you call 911. And it's basically, there is a medical emergency happening at the address of whatever the place is. And I wrote down the address. Please, we need emergency medical services or an ambulance or things of that nature to respond. There's currently care being provided to the injured person, to the athlete, to the patient, whatever you want to say, by our athletic trainer. They are currently doing, and then there's a blank spot. The athletic trainer should at least tell CPR, bleeding control, immobilization, something just briefly. That's all that dispatch really needs to know, is that there's somebody providing a form of care. And then and then after they say that, there'll be somebody there to flag EMS down. Mm-hmm. Do you have any questions or directives for us? And then I make sure that the person who called 911 is the person who hangs up last on the phone, because dispatch might walk you through a few things. They might ask you to make sure all the doors are unlocked, things that should already be documented in your EAP, but they're going to run through and make sure. That's fine. People kind of freak out because they're like, oh, ambulance isn't going to come until I hang up. It's not the case. Dispatch is already, the second you say, I've got a medical emergency at this address, an ambulance is on the way. They've already got it out there. Most dispatch centers that I have seen have two separate dispatchers, where they have the person taking the phone call, and they have the person dispatching the ambulance or the fire truck or the police car to the actual area. So now the athletic trainer, I don't think, unless you're the only person there, I don't think that the athletic trainer should be the one making that phone call. That should be a game administrator, the police officer, like you mentioned, somebody else, so the athletic trainer can focus on providing appropriate care to the athlete. Now I'm going to be doing whatever I'm trained in and whatever tools I have. If it's CPR, AED use, splinting, whatever it is, that's what I'm going to be doing as the athletic trainer while I'm waiting for EMS. I should, I might check and make sure that I have somebody going to go and flag down EMS. In my personal experience driving lights and sirens to call, I'm always looking for that person who's waving their arms frantically, because that's going to help me out. And most likely they're going to know the correct pathway, because sometimes I might not know how to get in. Might be traffic, a gate might be locked. They're going to most likely know or have keys that will go to where it needs to be. So athletic trainers providing care, EMS walks up. The athletic trainer, I'm going to look at them. I'm going to say, hi, I'm so-and-so. I'm the athletic trainer. We have a 18-year-old male, witnessed cardiac arrest approximately 5 minutes ago. Immediate CPR was started. Patient has been shocked 2 times, 1 time, whatever it is. They've been easy to tag.
Is this on the phone in the report, or when the ambulance gets there and you jump out of the back?
This is when EMS gets there.
All right, so EMS arrives, your gates are open, you're waving them down, they come on in, you come out with your cot, you come onto the field, and then here I am, I'm stable in C-spine. I see you. All right, so what is the information I need to get to you while you're walking over to me?
So, normally, for athletic trainers and for most parts, we have to be the calm in the situation. So I'm going to wait until the EMS provider goes, what's going on, or who are you, or things of that nature. First thing I'm going to do is I'm going to identify myself as an athletic trainer. And most of the time, hopefully, the EMS professional knows what an athletic trainer is and is not going to assume that we're a coach, somebody who just lifts weight, somebody who just deals with water. So hopefully they know that. If not, then I'm going to say I'm a qualified healthcare provider, a healthcare professional, something along those natures. And then I'm going to say roughly, if I'm in a secondary school setting, I'm going to say we have a 16-year-old. It doesn't have to be an exact age if you don't know the exact age, just a general idea. We have a 16, we have a 60 if it's a fan, whatever it might be, year-old, male, female, whatever their injury, whatever you differentially diagnosed as their injury, open fracture, open lower leg fracture, cervical spine fracture, things of that nature. And then what you deem to be pertinent medical history to that. So, they have they report no feeling below their chest. They cannot move their legs, or their legs are numb. They have C-spine pain, things of that nature. Just those quick, brief kind of, this is what made me call you. That's kind of what I should be delivering to the EMS. Is this is why I called, because this is what I've deemed as the emergency. And then allow the paramedics or EMS to ask their questions. They might ask questions. They might start doing their evaluation. Kind of just let them do what they're going to do, and talk with them. Hopefully you've got a decent enough relationship where they know who you are and trust you. I've heard the stories, and the stories make me just as angry, of paramedics and EMS kind of pushing athletic trainers to the side. I understand how frustrating that is. That's not how it should be whatsoever. Sometimes we can't just fix people's attitudes. Just let it go. They're now taking over the scene. Let it happen. Deal with it post emergency. So I'm just telling them, age, this is what made me call you. This is what I've done. This is what, if they ask, this is what I think we should do, whatever it might be, and then work hand in hand with them together. Say, I've got the head. I'm good on the head if you're mobilizing C-spine, whatever it might be, and then just talk with them through things.
All right, so we deliver the information, they transfer of care, they get them packaged, they get them in there, they're gone. Okay, second scenario, which is not a serious scenario I have in my school, but let's say EMS is there, it's football, they're there, it's Friday night, they're going to be there for the game, they're not going to leave. Medical timeout, and going over there, introducing yourself, what information absolutely are you going to give to those 2 or 3 people?
Correct. So it depends on your situation, your scenario, and who all is there. So in my medical timeout, I'm going to have my team doctor, the visiting team athletic trainer, if there is one, and then my EMS. All medical professionals who are going to be there. In my setting, I also include my equipment manager, because he's the one who's going to be getting all of my gear for me. So I'm going to talk to them. I'm going to say, whether it's radios, hand signals. I know you mentioned this. For me, it's this. Whatever the hand signal is, I'm going to make sure everybody's on the same page there. And I know some people have multiple hand signals for, I need the AED versus I need the splint. I'm going to make sure that everybody kind of understands where all of that is. Then I'm also going to ask EMS, are you transport capable? Can you transport? In my settings and my scenarios, I've never met a private company that won't transport, but I know that they're out there and they've happened. So just having that idea of, if we need to call 911 to actually transport somebody while we're taking care of this patient, I want to make sure that somebody's getting that taken care of while we're transporting the patient. So it's something just good to have in the back of my mind as well. And then the other thing is there anything that I always end, is there anything that you would like me to know, or is there anything that you need from me? I know from my own personal experiences covering sporting events, I always liked to make sure that I had a great, athletic trainers always, they always fight for good position on the field or the court to make sure that they see. Sometimes we have fans block us, things of that nature. Your EMS should have just as good as seats as you do. Whether it's on the sideline, whether it's on the end zone, whatever it be, making sure EMS can see it, and that they can see, and that they have easily and accessible equipment there, and that their equipment is secure. Secure for 2 reasons. One, EMS, just like athletic trainers, we have cool equipment. People want to touch things and play around with it. And then the other thing too is, if you've got a paramedic, they most likely have narcotic pain medicine somewhere with them or close to them. So you want to make sure that nobody tampers with that as well. So the medical timeout to me is to really get everybody on the same page about the EAP. I might pass out, printed out copy of the EAP, make sure everybody's on the same page, and that we're all going to handle an emergency well if needed.
All right, so I have an AED, I have a long and a short SAM splint, and the stop and bleed kit, and I have a non-cat tourniquet. So what equipment you have? So that's the equipment that you have. What is the equipment you are lobbying to get and purchase, either in the next year or the next 2 years or 3 years with your athletic director in sports? What other equipment do you want to add to
Right.
that?
So my first ad would be a bag valve mask. As healthcare professionals, we're kind of moving toward more and more towards not providing mouth to mouth breaths, especially with 2020 and coronavirus. A lot of people are starting to not do the mouth to mouth breaths anymore. Bag valve mask is just as good. So I'm going to be pushing for a bag valve mask. I'm going to be pushing for an airway, some form of airway adjunct, whether that's an OPA, an oropharyngeal airway, or an NPA, nasopharyngeal airway. Those are both easily within the scope of athletic trainers, and every athletic trainer should be trained in them. They're pretty easy to put in. Or a form of a more advanced airway, which is still within our scope, like a king tube, a combi tube, an iGel, something that can help me secure the airway. If you want to, I know that some people have issues, but vacuum splints is another thing that I might look into purchasing. Some people like, depending on your state and your standing, physician orders emergency medicine, whether that's Narcan, epinephrine, things of that nature that you can carry with you. And then those are really the big ones for vitals, equipment, a blood pressure cuff, a stethoscope, a thermometer, all of that as well. I think are all essential things to have. In my situation, and in talking with you and others, without including the AED, you can probably get all of your emergency equipment for $900 or so, $850, something like that, which is a lot of money. And for some schools, that's a budget. That's the whole budget. So just kind of working and saving up, buying one thing at a time. Go to Walmart and buy a blood pressure cuff for $30. Now I've got that. So just slowly building up. That's how I built my first training room of emergency equipment, is just buying one thing at a time.
And I know in the Wolfpack we talked very extensive about this in the OPAs and MPAs. So let's say you're like, hey, we did that for like an hour one day 3 years ago in school, and I'm not really confident in that. Where are we looking to get that training?
So I know that the NATA, at least in Vegas, I believe that they had a training scenario setting where you could practice putting in those more advanced airways. Also, that's where your relationships with EMS come into handy. That's when you can contact them and say, hey, are you all doing a basic airway lab anytime soon? Is there any chance I might be able to join with you on that? And work with them, and most of the time they'll say, I coming from my experience and my background, I've been the EMS company, so we've never had issues saying no, because I'm going to promote it and say yes. And I've got a great relationship with my EMS currently, so I have no worries in them saying no. But definitely do not purchase and or use items that you have not been trained in and do not feel comfortable with, because you can cause way more harm than you can do good. So, or even like team docs, if you've got an ortho team doc, they might not be great at airways, but I guarantee you they probably know an anesthesiologist who's fabulous at airways, or an ER doc who can help you out as well. That's all just where relationships go, and just reaching out and asking those questions. I know as a first few year athletic trainer, it's intimidating maybe to go talk to your team doc and ask those questions, but just going up and saying, hey doc, I understand airways are important. Is there any chance you might be able to help train me on some airways? If you can't, is there a way I can maybe sit in with an ER doc or something like that? And I've never had doctors kind of turn me down. They appreciate you wanting to learn.
All right, you want to transition into the equipment that you keep and use?
Yeah. So I sadly I didn't bring home my own work kit, but I have a personal kit. you know, people call them emergency cardiac care bags. People call them emergency bags. I affectionately refer to mine as an oh shit kit. And it's come at the fact that when I say oh shit because an injury happened, that's more than just you twisted an ankle or I blew out a knee. I'm going to need everything that's in this kit. So it's got kind of all the equipment that we've already touched on, but I can definitely go through and kind of show what I've got and discuss it a little bit and why I carry what I carry, because everything's been thought of for more than just a few seconds. It's, you know, this is oh shit kit version 18 and a half or something like that, and it'll continue to grow. So it all just kind of depends. You know, like I said a little while ago, never buy equipment or use equipment that you are not trained for and that your state practice act does not allow. I'm a licensed athletic trainer both in Colorado and in Texas. Both have very liberal practice acts that allow me to kind of do as I please with my supervising physician. So just talking with them, making sure that I know how to do everything. So I'll kind of show off my kit. This is my kit that I keep in my car, but I also use for PRN events. So this is it right here. If you follow me on Twitter, you've kind of seen it before. My other work kit is a little bit more identifiable. It's neon blue, just easier to see in crowds and things of that nature than a black bag. But it's got a red handle on it. And then I also put red up top here as well. Just so I can say, you know, grab the red handle bag. That's a pretty easy thing. So up top, kind of here, I've got all my vitals equipment. So I've got a pulse oximeter, great for getting a good idea of pulse. I don't trust these in emergency situations. I'm going to be doing a carotid pulse, making sure that I know where all my pulses are. But it's a good thing to have, just monitor. I've got a stethoscope. I recommend spending a little bit more than your cheap $10 stethoscope from Walmart. You'll be able to hear a little bit better, especially if you're working in loud environments like the stands. That's going to be the best thing for you. I have both an adult and a child BP cuff. I keep them separate. So my child BP cuff is in a case because I'm going to use that probably a little bit less. My adult BP cuff is out because that's mostly who I work with. I work with mostly full-grown adults. If I'm working in a high school with, you know, a lot of young freshmen or middle school age students, I might think about having this out, or identifying it a little easier to tell. I also have a glucometer to test blood sugar, making sure that it's got everything that it needs to, which is lancets, strips, and then the monitor. I check this as well, make sure it's all good. And then I have just an oral thermometer. I know that rectal thermometry is great when it comes to heat illnesses. I work in an ice rink, so the chances of me having a heat illness is very, very slim. I'm not going to say it's impossible. It's very, very, very slim. And so I haven't shelled out the amount of money for a rectal thermometer, but it's definitely a recommendation of some form of thermometer, just oral or whatever it might be. On the inside, you know, I carry on the outside compartments. There's just gloves and stuff that you just fill up the pockets with. Nothing super special. Biohazard bags, things of that nature. On the inside, I've got all my little things are in these little bags. I think compartments are great because now once I have somebody bring me my bag, I can now say grab the green airway bag, grab the red bleeding control bag, things of that nature. So in my airway, I talked a lot about the importance of a bag valve mask. So this is my bag valve mask. It's probably unlike every other bag valve mask that you have seen. It's a pocket bag valve mask. I don't know why they call it a pocket bag valve mask because this does not fit in my pockets. But you just open it up like so, pull it out. Now I've got a full bag valve mask that I can use in emergency situations. Then, as we talked about a little earlier, We have, these are NPAs or nasopharyngeal
Can you lift it up
airways.
a little higher?
Oh, sorry. These are NPAs, nasopharyngeal airways. I always like to have lube attached to them. If you know how to use an NPA, then you know what the lube is for. So you use lube, and then I always write the expiration date that everything expires on, just so I know when I need to replace them pretty easily, because sometimes the expiration date is pretty small on these. The other airways that I carry are OPAs, Oropharyngeal Airways, which are the hooks like this. You just slide them into the mouth and it kind of holds the tongue. Again, you need proper training for this, but these are, OPAs are probably the cheapest airway that you can get. You can buy a set of them for $2 or $3, I think. So they're pretty easy to get. The other airway that I carry is something called the iGel, or the and this is a more advanced airway. This is still within the athletic trainer's scope of practice, but it does require some additional training in how to use it. This is what's referred to as a supraglottic airway, meaning that it does not cross the vocal cords. Intubation is the only airway, and I guess surgical tracheotomies also cross the vocal cords. So this is definitely within an athletic trainer scope of practice with appropriate training. Pretty easy to put in, and highly recommended as well. So that's all my airway supplies for everything that I need to go. On the sides, like you had mentioned, I've got my trusty SAM splints. I actually carry 2 of these, one on each side. SAM splints are great. In some cases, they can replace a cervical collar, and you can use them as a cervical collar as well. So now that's one less thing that I need to carry around. It's a twofer. So SAM splints are absolutely great.
I never would have thought doing that. Nice little fun.
As a cervical collar?
Yeah, I never would have thought that.
Yeah. It's not the most comfortable thing, but in a situation where you need to have it, it's better than having nothing. And it's cheaper than most cervical collars as well. And now I've got a splint and a C collar. So the next thing I've got is my trauma bag, also known as my Stop the Bleed kit. So I'll touch on this, but you mentioned tourniquets and real tourniquets versus fake tourniquets. So the tactical casualty combat care certifies tourniquets, and there's a lot of fake tourniquets out there. Really, the fake part is the windlass is not actually metal. So this part here is not actually metal inside and would actually snap off if it breaks, thus not allowing the cat tourniquet to do what it actually needs to do. So in order to tell if your cat tourniquet is real or not, is on the ridges here. Let's see if the light on the ridges, next to the ridges, you'll see the word cat. Make sure that that's actually written there and that it's raised up. You can kind of see it there a little bit. On the back, on the little plastic piece, it's also going to say the word cat and be inscribed. And then the last thing that it'll do to tell if it's a cat tourniquet or not is it'll have a lot number. Lot number on the back right there as well.
So is cat the standard in terms of tourniquets, or?
It's the most frequent one. The other most frequent one that I've seen is called a soft T wide tourniquet. I've never used one in practice. But there's the Tactical Casualty Combat Care Committee, I think, has 7 or 8 tourniquets.
Okay.
Cats are kind of the most, they were the first ones, I believe, and they're the most common. A real cat tourniquet costs about $30 or so. So they're kind of the ones that you're going to find most places. All tourniquets work mostly the same. So once you're trained on one, you should be able to use the rest of them. But of course, make sure that you're trained in your specific equipment. Another thing when it comes to cat tourniquets is being stored properly. In stressful situations, your fine motor skills are the first things that go. So I want to limit the amount of fumbling that I need to do. So I keep this little time cover. I keep that open. So that way I don't have to work on opening it up to get my windlass. So now my windlass is free and I can tighten it down. I also fold my cat tourniquets in a very specific way. So they look like this. That way I can easily open them up. And that's about a 12 12-foot diameter or 12-inch diameter circle. I don't know what leg isn't getting through that, but if it is, I can just quickly unvelcro and get where I need to go. But for the most part, that'll cover everything that I need it to do. So in order to properly fold your cats, it's real simple. You just bring it all the way down from here, pulling it down, and then I'm just going to cross over, going up and down until I run out of space. Once I run out of space, I'm going to feed it through that singular loop. And now my cat tourniquet is all stored and ready to go. Just saves a few seconds of time when bleeding out like crazy.
And I appreciate that fun fact that you put that on Twitter in the Wolfpack, because I went to my school. I made sure I set mine up like that, just in case, you know.
Yeah, just in case. You never know. The other thing that I have in here is chest seals. So these are hyphen chest seals. These are for chest injuries. Doesn't necessarily need to be like a gunshot wound, but that's where they're most commonly used. Just any type of sucking chest wound where the air is bubbling out of the chest is where you're going to be using these. Pretty easy to put on. You just put one. I recommend a twin pack, so there's two, because if it is a gunshot wound, you're most likely going to have an entry and an exit. So good to have two in that scenario.
I think I saw someone on Twitter said to keep your expired AED pads, because you could use that. Is that an actual legitimate thing?
Yes and no. So the AED pads can use something similar to like an ultrasound gel that to provide the adhesive. And so as long as the AED pad is still has adhesive, it would work. But I'm not going to trust my AED pads to do that. I'm going to trust a commercial product and have my AED pads be a secondary scenario if needed, because I just don't want to trust. It's expired for a reason, and a lot of that reason is because the adhesiveness might have already dried up. So it's a good, if it's all you got, it's all you got. It's better that than nothing, but I wouldn't trust it with anything. So. Another thing that I carry is called an Israeli bandage or an emergency trauma bandage. This is basically a large ACE-wrap with a piece of gauze on it. Great for holding in your wound packing gauze and tightening it down and just providing a good amount of pressure onto the exact area as well. And then the last thing in my trauma is just some rolled gauze. You can use rolled gauze or specific wound packing gauze. Rolled gauze is a little bit cheaper. So I've got that in here just for wound packing to be able to pack those wounds if needed. Most of the wounds that you're going to wound pack, you could do extremity injuries, but you could do neck injuries and groin injuries, places where it's hard to put a tourniquet in. Stop the bleed training takes about an hour, and most of them are free or pretty cheap. So I recommend everybody gets Stop the Bleed training, and that's where they cover all of this if your athletic training course did not. The other thing I carry in here is a gauze bag. It's exactly what it is. It's just a ton of gauze of different types, some wound wash. The other thing that I carry in here is something called Celox powder. This is very similar to Quick Clot. It's basically just a powder that will help clotting agent. Quick Clot is basically gauze with a protein in it. Most of the time it's shellfish protein that helps clotting. And people hear the word shellfish and think automatically, oh, well, people with allergies to it don't need to worry about it. People aren't allergic to this specific protein. It just helps with clotting to stop bleeding in those scenarios. Celox is just a powdered form of that scenario. Next, I've got OTCs, over-the-counter medications, and also emergency medications in here. So I've got things like my ibuprofen, my Tylenol, things of that nature. Some things that other people might not have is I've got Narcan for opioid overdoses. It's highly recommended. Most states have a Good Samaritan Opioid Overdose Practice Act where you can go to a pharmacy and get Narcan yourself. I also have an EpiPen, and then I have glucose for my diabetic emergencies as well. All things that are pretty good. I recommend the glucose gel over the tabs just because it can get absorbed a little bit easier. In order to give these, patients must be able to chew and swallow. The tabs with the gel, they must just be able to swallow it. So let's say they go diabetic low and they've got to blow to the jaw, or they're missing teeth or whatnot. I just have to be able to squeeze this in and get them in for it as well. So I highly recommend the gel over the tabs. But I do carry the tabs with me as well, just in case. The other thing I kind of carry with me, the other biggest thing, is I have a personal AED. I think all emergency kits should have an AED in it. This is the heart sign Samaritan pad. It's more for generalized public use, not necessarily athletics, but I got a pretty good deal on it. So this is something to carry. Whatever your AED is, just make sure that it's always functioning. So you can notice here that I've got my flashing light. That means that it's functional and ready to save a life. In the back here, I've got my monthly checks. So I do a monthly check to make sure and document that my AED is good. I also do a check if I'm going to a PRN event. I also check it and make sure that it's documented there as well. I've got a towel, like I mentioned, always making sure that you've got a towel to wipe sweat off, things of that nature with. And then I've got a little, just a little kit here it's got a CPR mask in it, and it's got a little razor, and it's got some trauma shears and some gloves and stuff in there as well, if I needed them. So just things to always include with your AED. Mine's all kept in this little case that came with it. So for the most part, that's the everything that I think an athletic trainer should have, kind of in their personal oh shit kits, whatever it may be. I've got the fun little tidbit thing that I've gotten here is I've got an OB kit. I've delivered one baby in my lifetime as an EMT, and it's the most disgusting and messy thing that I've ever done in my life. And I don't want to be cleaning that up. So this kit rides with me in my car. So if I pull over and somebody's in labor, I'm able to help them out, but athletic trainers don't need that. So that's basically what's in my oh shit kit, besides, biohazard bags, ice bags, things of that nature, gloves, your basic stuff.
That's a lot of good stuff. And as he mentioned 2 or 3 separate times, only buy the stuff you're trained in and the stuff that your state and your practice act, your standing orders allow you to do.
Yes.
Yeah, don't just watch this and then buy all this stuff and you're not trained in it, and then you go out there and seriously harm someone who's already in an emergency scenario. That's not what this is for. This is just a learning educational video. One thing I want to reiterate for everybody is that for those big events, you get caught up, you got to prepare all the kids, you got to get them all, like Friday night football, you got to get 60 kids ready, you're talking to your coaches. Admin always needs something. You got to say hello to the other team, medical timeout, EMS. Make sure there's no cars, there's no vehicles blocking your emergency entrance. And I would even make sure that if you're the away team, I say, what's the emergency entrance? South side. You're like, all right, cool. No vehicles there. I have been in a scenario where I called 911 and at an away game, I was the only athletic trainer, and our bus was blocking the entrance. So little things like that you don't think of, and then it happens, and the ambulance is on the outside of the gate, and you're like, come on. So just a little fun tidbit. Well, I appreciate you sharing all this information. If I'm watching this and I want to follow you on Twitter, what's your handle?
So it's Dillon _ATC_EMT. I'm mostly active on that. As Tom kind of mentioned at the beginning, I share a lot of useful emergency medical tips, tricks, like the tourniquet was something. I also give tours of my bag. I've got a tour of my actual work, my official work oh shit kit, of my other kits. And just pass along advice, whether it be emergency action plans or things of that nature, how to write them, how to do a medical timeout, whatever it might be. just trying to spread the knowledge and things of that nature. I push emergency medicine very hard because when it comes down to it, it's our athletes' lives in our hands at that point in time. Whereas if an athlete has a sprained ankle and I'm not sure how to rehab it, or I'm not sure how to eval it or things of that nature, I've got time in a sprained ankle to quickly open up my old textbooks or pull out the Google machine and look something up. In emergency situations, I don't have that opportunity. I have seconds to make my decision on how to act, how I'm going to best treat my athlete, and how I'm going to keep my athletes safe. So being skilled and prepared is really what it's going to come down to saving an athlete's life. Hopefully it's a scenario that you never need to find yourself in. But especially for young professionals, I know a lot of young professionals who are very, very nervous about the first time they have to run out onto the field, about the first time that they have to call 911, things of that nature. Practice, prepare, talk with your EMS, talk with me. I'd be happy to. I've called 911 millions of times. I was 911 at one point. It's all just talking and learning, getting better. I've been in EMS for many years now. I've been an athletic trainer for a few years now as well, and I still train frequently. As Tom mentioned, doing 20 minutes of CPR in 10 seconds. It's just still practicing and getting better. Just like our athletes practice every day to get better, I practice every day to make sure my athletes' lives are safe.
That was a compressed. He did 20 minutes of CPR, but compressed the video so it would fit on Twitter. So it wasn't. He didn't actually do it. Yeah. Okay. One thing I want to bring up, because we're talking about the transfer of care, and sometimes it goes real smooth, and they acknowledge that you're a provider, and sometimes they're just like, "Get out my way," and I'm doing this. What happens if you have more of that hostile EMT paramedic in terms of a heat stroke, heat exhaustion, and you're attempting to cool the patient?
So that's the one. So I think I mentioned it with you. Now is not the time for fighting. In heat stroke scenarios, I'm fighting. That's the one scenario where I'm going to fight. And the most EMS are going to be trained that way. And if you look at the new 2020 guidelines for at least American Heart Association, they are in their, and I believe even in their healthcare provider courses, they are talking about cool first, transport second. That's the gold standard, and it's starting to become that's been the gold standard in athletics currently, and it's starting to grow in other settings as well. So hopefully, as more and more knowledge gets shared, we won't lose athletes to heat stroke. And it can be hard to diagnose, but that's where rectal thermometry comes into play. And it's all about, at some point you need to be able, paramedics and EMS, they might get mad at you, but if you've got data to back it up, if you can show them a thermometer and your thermometer says 104.1 degrees on it rectally, they're not gonna fight you on that. And I know that a lot of people hate rectal thermometry and don't think athletic trainers should do it, especially in secondary school setting with minors, because their administrators won't allow it, things of that nature. As athletic trainers, we have a duty of care to our athletes in order to protect them and keep them safe. And if I'm going to get fired for doing rectal thermometry and cooling first, transporting second, then fire me, because I guarantee you somebody's going to hire me like that in the next day or so, because I was able to do that for an athlete. So that's the one situation where it's worth the fight. And definitely with EMS, it's worth the fight and showing what you've got and your skills. Hopefully as we continue to push the knowledge of athletic trainers, that becomes less and less of an ordeal, and you have a better relationship with your EMS, that becomes less of an ordeal. Sadly, it still happens, but we're working, and one of these days, heat stroke will be 100% preventable, because everybody will be able to work together.
I think having a device like a data therm is just as important as having an AED. And I think we absolutely should be using that.
Exactly.
Because we see it every year, and we don't see it once or twice every year. We see it, more than a handful of times.
Yeah.
And that, I know that if you're starting, you're a young professional, your early career, you're a student, there's a lot of things you have to do as an athletic trainer, especially if you're at a high school, you're solo. I understand, but you need to spend time to call up your firefighter people, your police people, are your firefighters, EMTs, like firefighter paramedics? Is it a third company, superior type, bring those people in, show them around. This is our football field, this is our soccer field, this is our basketball, this is how you enter, this is what we're going to do, this is the tools we have, here's our sign, this is what to expect. I know that's a lot of extra work, but it needs to be done, and that's going to prevent, hopefully, or mitigate a lot of headaches that can occur when it's go time. Because when it's go time, the standard of care you just don't become this machine and you're just awesome. You're going to fall back to what you're trained on and those relationships. So you got to do it.
Exactly. But, I think we're all scared for the first time that we might have to do CPR. And I'm going to use myself as an example here. I was even working on an ambulance, I was dead scared of doing CPR the first time. And it's happened, and I had to do CPR, and 100% your training kicks in. I couldn't think of anything else besides this is what I've been trained to do. And that's what you fall back on. And, it might seem like it gets old and it's pounded into you in school, but it's 100% true. It's 100% real. And that's what can save lives. Just fall back on your training. That's why I practice every day.
Absolutely. And let's say it's football, because that's the big sport. Everyone loves football. And when that oh shit moment happens, you run out there and you go to feel a pulse. You don't want that to be the first time you're removing a helmet and shoulder pads.
Yeah.
You want to practice
that. Yeah. And going off of that, depending on where you're at, and if you're removing helmet pads and shoulder pads prior to boarding somebody or whatever it be, don't practice on somebody who's not going to tell you did it wrong. Practice with somebody who you trust to say, I felt my head move. I felt my neck move. I felt my body move. Have somebody who's willing to say, you did not do that right. So that way, that I need to change how I'm doing it in order to practice. Because just going through the motions, if the motions aren't right, then they're not going to be right when it needs to happen.
Well, I thought this would be like 15, 20 minutes. I don't know how long we talked for. I'm surprised we haven't got kicked out yet. Magical. But thank you for spending your Sunday night just being passionate and educated and getting all this information and going through your oh shit kit and talking about scenarios. Because I think it's awesome. So thank you very much.
Yeah.
Have a great Sunday. Hopefully I see you Tuesday in the Wolfpack. If not, have a Merry Christmas, Happy Holidays, New Year's. All that fun stuff, brother.
Well, have a good one, everyone.
All right. Bye, buddy. I'll talk to you later.